Welcome to the Ketones and Coffee Podcast. I'm Lawrence, and I'm so grateful to have you joining me on this journey. Every week, I bring in guests to have the knowledge and experience to help you on your own journey to a better health. I'm so excited for this, guys. Today, we have a very special guest with us, Dr. Elizabeth Bright, an esteemed osteopath and naturopath who stands at the forefront of holistic health. A graduate of Columbia University, her journey into wellness has marked by a pioneering spirit and a commitment to empowering her patients. Since 2016, she has embraced a high fat carnivore diet, utilizing it as a potent therapeutic tool in her practice with a profound understanding of the body's natural healing mechanism. Dr. Bright has authored two books: Good Fat is Good for Women, Menopause, and Good Fat is Good for Girls, Puberty, and Adolescence. It's an honor, Dr. Elizabeth Bright. Welcome to the Ketones and Coffee Podcast.
Thank you. It's an honor to be here.
Dr. Bright, it's an honor. I wanted to have you on the podcast because you firmly believed in alternative diet approaches to optimal health, which is, we talked about
Mhm.
the carnivore diet, an all meat diet, focusing on thyroid health and adrenal functions. You believe that it is not just the most effective way in treating thyroid issues, but also the lifestyle that you have adapted since 2016. So I would love to hear more about that story on what first led you to discovering that. Now, we all have that programming of what it is to be healthy, coming into the low carb lifestyle. But what was that experience like, and what led you to adapt and advocate for a high fat carnivore diet?
I went into menopause at 52. I was already eating a ketogenic
Mm.
diet. I had already removed carbohydrates except vegetables. So at
Mm.
52, I went into menopause and I read about how awful it was supposed to be, and I didn't believe it. And then for some reason, I guess expediency, we stopped eating vegetables as well. I had remembered a time when I had a lot of stress and I couldn't digest anything except meat in my 30s. And so I actually started reading Ella Mahern's articles because I
Hmm.
am a thyroid expert, and she had written about T3 on the carnivore diet. And so I just followed suit and we just removed all plants from our diet.
And you said that you could only process meat. Is that right? Like
And
how when was that?
when I was in my 30s, when I was in a particularly
Hmm.
stressful state, there was a time I was doing a lot of kung fu. I was working, and I
Hmm.
found that I had indigestion if I ate anything other than meat. And I didn't do it for very long. I did it for
Mm.
like 2 weeks, but it stayed
Yeah.
in my memory as a time that, oh, that worked then. That seemed okay, so I'll go back to it.
So like you what was the change that you made at that time when you in your 30s? Did you stick to a only meat diet, not knowing that you're doing a carnivore diet? Hmm.
Yeah, only meat diet for about 2 weeks. I seemed to digest only meat better, but then
Mm.
ignorance and not knowing enough about it and not following through on it, I was doing a lot of, as I said, kung fu, so I hadn't yet looked into ketosis. I mean, I knew about the Atkins diet,
Yeah.
but I hadn't yet made the switch to using ketones for energy instead of carbs. So all that working out, I thought I had to do, had to have some carbohydrate in my diet, which is completely wrong. And I sort of circled back to that 20 years later.
Yeah. And then you said that carbohydrate and how it's essential, deemed as essential for, we talked about exercise, we talked about just overall health. And for me, I switched to a carnivore diet, and there's nothing easier to adapt to for me.
Oh, yeah.
Coming off of a keto diet, it's simple. I love how I feel on it, and I'm just depressed when I'm not on it, not understanding what's going on until I really did my research and really talked to experts and having these discussions. And one thing I really love is that it just gives me a heightened sensitivity to food and helps me get uh helps me eat intuitively. I always say it's a superpower of mine. I'm so connected to how I feel now, and I'm not sure how long I've had that, sensitive feeling to food, but I didn't have that before. And it was just brushed off to depression. I feel like a few years ago, I went on keto for weight loss, and then slowly my energy improved and my symptoms of depression back then, slowly my symptoms are gone, basically.
It's
Before
great.
we get into yeah, I want to talk to you about, before we get into all the different ways to treat thyroid issues, which is your expertise. Let's understand its functions for our body, right? You talked about menopause in the beginning. We'll discuss that a little bit later on. Can you get into what the thyroid gland is, also what it is and what it's made of, and what's its main function?
Well, the thyroid gland is actually the first thing formed in the
Mm-hmm.
body in the fetus. So
Mm-hmm.
when the endoderm is formed, the thyroid gland, there's a little tiny ball, and the thyroid gland is the first thing
Mm-hmm.
that's born before the neural tube, which becomes the brain. And actually, thyroid tissue and the intestines are made from the same tissue. So then, obviously, the fetus expands, it gets bigger, more organs are formed, but the
Yeah.
thyroid promotes, provokes, and starts the formation of all the other organs in the body. So the thyroid is really the kickoff for the formation of the fetus.
Mm-hmm.
So it's related to every single function of the body for that reason. So it can turn on genes, it can turn on and off, switch genes on and off. It regulates heart rhythm, it regulates
Yeah.
the adrenal function, it regulates everything in the body. So it's a thermoregulator, it's an energy hormone, and it's a healing hormone. So there isn't really any function in the body that
Yeah.
is not involved in.
My real, not, I don't want to say concern, but what I really want to understand is, why isn't that a common knowledge, right? I talk to, obviously, doctors on, like, the doctors I personally know, the and the fact that there's a lot of misdiagnoses going on, right, in the health, medical industry, the conventional way of treating thyroid issues. I mean, I believe that I've had these discussions before with experts, and thyroid issues are really hard to detect because there's so many different symptoms, right? Since we talked about how it can affect multiple functions of the body, right? There's a plethora of how a thyroid issue can manifest, right? That's why it's so difficult to detect, right?
Exactly. Well, I
How it
wouldn't
is,
say it's
yeah.
difficult
How,
to detect.
mm,
I wouldn't say it's difficult to detect. In the 50s, they had one of the most famous American thyroidologists, George Kreil, wrote a book about thyroid function. Unfortunately, you have to understand that medicine started out, basically modern medicine was born in the 1800s. And what they did was surgery. They did a lot of surgery, or they did poisons, laudanum, mercury, and things like that. So there was a whole movement away from, I wouldn't necessarily say, um,
mm,
plant medicine, because plants are just as medicinal as the modern medicines that all medicines were made out of, were made where they started out as plants. But at the time, you would look at thyroid textbooks at that time, and you'd have, you know pages and pages and pages and pages of symptoms, as you just said, because people would come in with all these symptoms. And back in the day, in those days, until about 74, when they isolated TSH, they would send
mm.
somebody with arrhythmia, not send them to a cardiologist, they would send them to a thyroid specialist.
What changed now? I mean, we
What
see
changed? More
over
drugs,
prescription.
more
Yeah.
drugs,
Mhm.
more different drugs to address any symptom is going to be the body's attempt to express a deficiency or an imbalance. So we address symptoms with drugs so that the symptom goes away, but then you have a host of other symptoms that come from the negative feedback mechanism of the body saying, "Hey, I was trying to tell you this. You
Mhm.
shut me up over here with that medicine." So naturopathy and osteopathy are the removing obstacles to healing. What happened is that pharmaceutical companies make a ton of money from addressing 5,000 things with medicine, with
Mhm.
different medications, instead of one function.
Isn't that something that always comes up, right? The pharmaceutical industry coming up with, an idea or a treatment for a symptom, right? as opposed to looking into what really goes on in the body, what really is causing issues within the body, right? We call it root cause healing, which is not really something that it when you go to your doctor, right? A typical doctor's visit wouldn't be about what's causing this, what's the root cause. It would always be about asking you about what's your symptom and how can we relieve that symptom right now. And then all of a sudden, obviously, if you take a medicine for a symptom, that symptom will go away. But what happens next is it may cause another issue down the line, or you may be you may be not addressing what actually is going on in the body. We talked about overprescription. We talk about how, you know, even teenagers, not understanding what's causing issues within the body, and they, taking antidepressants for symptoms, taking what else are they can you take us to a textbook visit to a doctor? What does that look like when you come forward with all of these symptoms? Like, what happens in there?
It depends. Well, which all the symptoms
Mhm.
that we're talking about that are associated with thyroid function, you come out with
Yeah,
a
yeah,
boatload of medications. So to
yeah.
hypertension, you're going to get a hypertension medication. Have arrhythmia, you're going to get a something that regulates the rhythm of your heart. If you
Yeah.
cry a lot, you're going to get Prozac. If you have,
Yeah.
if you're constipated, you're going to get laxatives. If you have endometriosis, you're going to get you're going to get hormone pills. So all of these things are caused by irregular thyroid function,
Hmm.
but you're going to get all these different medications. I mean, it would go on forever if we talked about all the symptoms, but
Yeah.
you can. It's just unfortunate that, and I will be writing my third book about that when I have time. But it is something that could be addressed without medications. But it's not just that medications create other symptoms. In my books, I actually go to the Mayo Clinic's list of side effects for every medication, and sometimes you have the things that the medicine is prescribed for, the symptom is prescribed for, the symptoms get worse. The actual symptom worsens. You have to read
Mm.
it.
I can't wait for that book, first of all, but I want to address that because how do we how do we finally catch this before it worsens, right? That's the main thing for me, for people, right? Obviously, it's never too late to change your lifestyle or diet or whatnot. Before we talk about diet and lifestyle, how do we how do we even detect this early on? Is there any most common thyroid disorder or symptom that we should be alarmed that to get your thyroids checked so that we cut to the chase and just get to the root cause? How do we do that?
Oh, okay. So for adolescents, it would be PMS, painful periods,
Mhm.
depression, anorexia, anxiety. For males, it would be obviously not the menstrual issues, but there would be acne,
Mhm.
possibly irregular hormones, because thyroid decides how many of each hormone is made. Depression again, eating
Mhm.
disorder. But then when you get to older people, gallstones, it really is unfortunately unending. And if we talk about the root,
Yeah.
I mean, yes, you can change your lifestyle, but the best way to know is that what I talk about in my book for the puberty and adolescence is if you remove all this crap, then you're basically
Yeah.
removing obstacles to healing, and you're allowing
Mm.
your function do the best it can. So the carnivore diet is basically a way for you, plus iodine, is a way for you to allow your body to do the best that it can.
Can we summarily
And
say
obviously,
that what yeah, can we summarily say that what we're eating right now, modern nutrition, is causing thyroid issues?
it's not nutrition anyway.
That's the
It's
main thing that
yes. So
changed. Yeah.
oatmeal, lack of iodine. The thyroid
Mm.
needs iodine to make hormones. So broccoli, cabbage, cauliflower, oatmeal, flax seeds,
Mm. Yeah.
Those all tea, all kinds of tea, all black tea, matcha,
Tea.
green, white tea, mint tea, they'll all interfere with the absorption of iodine. So then you can have thyroid issues because
Really?
you are taking all these substances because you don't have enough iodine. And it's already hard to get iodine from our food sources anyway. Then the older you get, hypertension, as I said, gallstones, 80% of all cholecystectomies are done to women. Mostly women are hypothyroid. Hyper, I say it's the same to me because a hyperthyroid is a sick thyroid because they've been hypothyroid often since they were adolescents.
Are you saying checking your thyroid should be the first line of defense if you have any of these symptoms? Can we say that?
But yeah, constipation is another one. Yeah, I
Yeah.
would definitely. I've had so many patients who've been diagnosed with mental health issues who were hypothyroid.
Mm-hmm.
Someone who was schizophrenic, someone who
Mm.
had bipolar disorder, somebody who had borderline. I checked their thyroid. Now they're
Mm-hmm.
not on
Mm-hmm.
medications.
So here's what I always say about the carnivore diet. It's not about the carnivore diet. People say, "Hey, well, how can the carnivore diet do all these things?" I always say it's about what you eliminated from your diet.
That's it.
Is that accurate?
That is absolutely accurate. That is absolutely you're eliminating stimulants, you're
Mm-hmm.
eliminating toxins, and you're giving the body what you're not. And you're not stressing the
Mm-hmm.
body because you're not interfering with its. We humans evolved to eat meat and fat. We are able to eat some other foods so we don't die if there's no meat. That's basically all it
Mm-hmm.
is. It's like an ability to address stress. So when you eat a carnivore
Mm-hmm.
diet, yeah, it's not just it's what you said it perfectly. You're removing things that can interfere with your function, and you're enhancing thyroid function
Mm-hmm.
because you're removing anti-nutrients. So if you eat anti-nutrients, the cabbage, the broccoli, the beans, the nuts, the things that have phytic acid, lectins, things that prevent you from absorbing magnesium, zinc, et
Mm-hmm.
cetera, iron. Thyroid needs that. The thyroid needs those nutrients which are in meat and water. Those are water soluble, and fat soluble ones are in the fat. If you remove those foods then you're enhancing your ability to make your thyroid work better and everything work better.
There's so many issues that we can get into when it comes to thyroid, but we talked about stress. We talked about how the carnivore diet can help with all these the thyroid issue by eliminating
Hmm.
the ultimate elimination diet. I want to talk to you about what we can do right now. I thought of getting us started with metabolism, something I am familiar with. And we know that blood sugar has been proven to raise cortisol levels more than fat and protein, which keeps insulin signaling down, causing insulin resistance and elevated blood sugar levels. So it
Hmm.
is an important piece to discuss. That's why I want to discuss our diet as a very important discussion. I think where the answer lies is understanding how glucose can raise cortisol levels, and then follows by how does ra- raise cortisol levels directly impact our metabolism.
Well, it makes sugar. It affects
Yeah,
our metabolism. You're in a stress state, and then your liver's making more sugar, gluconeogenesis. So when you're in a stress state,
yeah.
your liver's pumping out sugar all the time to get to your muscles. It thinks you're running away from danger, but you're just sitting there eating French fries.
Mm.
So, um,
Mhm.
it's doing all the things that it thinks you need. It's upping your blood sugar, so you need that sugar to run like hell, defend
Mhm.
yourself. But you're just sitting there eating French fries.
How does that work? Like, how does glucose raise cortisol levels? Like, explain that
It's a
mechanism.
Glucose is a
Mm.
stimulant. So, because it being a stimulant, it will make any stimulant raises cortisol levels. Coffee, nicotine, ice baths, ultramarathons, marijuana,
Mm.
fighting with your partner, all of those
Yeah.
things are stimulants and they raise cortisol levels. And we know that fat brings cortisol down,
Mm.
animal fat.
How does that happen? How does fat lowers cortisol levels? Do we have
It
that
lowers
mechanism?
cortisol. I guess because
Yeah.
it will lower, if you have fat, you will lower glucose, right? So we know that if, for instance, if you have hypoglycemia, right, you are your blood sugar drops too low, and then your liver makes a ton of sugar, and then your insulin
Mm,
is, you have too powerful an insulin
yeah.
response. So you're on this roller coaster, and that's stressful, right? If you dump fat in there, the glucose goes down. You're switching from glycolysis to ketosis.
Mm, and it's therapeutic for our cells. It reverses chronic disease. How true is that? How true is it reverses chronic disease? Can we say that it reverses it, or can we
It,
say
because it reduces
remission? Yeah.
inflammation. It
Yeah.
reduces inflammation. Whenever you reduce inflammation, you are able to heal whatever caused the chronic disease.
Can we say heal? Is that something that we can say? Can we say we healed type 2 diabetes on the carnivore diet?
I say it, yeah, sure. Sure. If somebody has joint pain, they can't move their hands, and they have arthritis
Yeah.
because they've been diagnosed with arthritis, and after removing eating a high fat carnivore diet for 2 weeks, they can move their fingers, I would say their arthritis is in remission. It's healed.
Mm. In
Just
recovery.
because you don't want to say healed, because, okay, so medically speaking, maybe you can't, if you've been, once you've been diagnosed with something, they don't like to let it go.
Right.
Right? So, like a person who has positive thyroid antibodies, they don't say you're healed of Hashimoto's if they go away. They say you're in remission. But I don't see the
Yeah.
difference.
To avoid to avoid, it's risking their career basically. They can't say
Yeah,
it.
yeah, right.
That's why this
Because
is so fascinating to me. You are you you are an advocate of the carnivore diet. You publicly say that the carnivore diet reverses or heals the thyroid condition, right? Which
well,
is
it helps it
this,
heal, right?
yeah,
Again, to the nutrients
helps to
to
heal.
heal. You also need
Yeah.
iodine, right? If you don't have any iodine, you're not going to heal the thyroid. And if you don't reduce
Mm.
the stress,
Eh,
you're still gonna, if you remove the French fries and you go and run, if you do your exercise at 5 p.m., you're going to be producing stress. So then you're going to hinder the health. You have to, there are a lot more. It's a lot more than just the food you eat. You could be eating a high fat
yeah.
carnivore diet and then go, do a marathon every other day. You'd never recover, and
Yeah.
you would be stressed. Your cortisol would still be there, and that would cause inflammation again, over and over again.
You talked about iodine. Can you explain the role of iodine and other nutrients found in animal-based foods in thyroid hormone production or regulation?
Okay, so
How does that
iodine
help? Yeah.
is isn't in foods anymore. So it used to be in dairy. It used to be more cows. When they milked cows, they would put iodine on the teats to clean them. Now, then they started using chloride. So unfortunately, we have many people deficient in iodine. Also, fluoride is in water and everywhere in car seats, bromide.
Mm.
There's so many substances, and everybody's told to eat broccoli and cabbage and flax seeds. So that there isn't a food that's rich in iodine. Meat is rich in iron and everything, but it's not rich in iodine. So it's not really, it's something it's the only thing I think people need to supplement in.
Mm. It's the only thing. If you supplement iodine,
Um,
all functions of the body should work as it should.
you
How?
have to also address
Yeah.
stress. It's never that simple,
Right.
Lorenz. It's not like just
Yeah.
one. If you take iodine and you run 4 marathons a week and you are on a carnivore diet,
Right.
you have to address stress. You can't just say, not one thing is a magic bullet. I just
Right.
wrote an article on
Right.
iodine. It's on Judy Cho's website because there's a lot of misinformation going on about iodine. So if anybody's
Mhm.
interested, that would be a good idea to look at. but it's an essential nutrient. You can't. It's like
Yeah.
vitamin D. You got vitamin D. You got to have iron. You got to. It's that important.
But you have to supplement it. You said it's not found in foods anymore. You have to supplement it.
No, yes, you do. You can't get enough. But you have to. If we lived, okay, it used to be only mountainous areas were iodine deficient. You know, people would have goiter in
Mhm.
Switzerland and the Andes and in Michigan, places where there were mountains and the soil was devoid of iodine. So the
Yeah.
iodine was in the atmosphere, not in those places, but every other most places, right? But then we invented all these things that interfere with the absorption of iodine. So today it's no longer. It's more. You'd say that the goiter
Hmm.
belt has expanded to include the whole world
Yeah.
because of these substances.
So you could so even though you, let's say I'm supplementing with iodine, and if I do things or I eat things that prevents me from absorbing iodine, what are those things that may prevent other things that may prevent absorptions of iodine if I may supplement it?
You would not be supplementing because those things would prevent the absorption. It'd just be coming out. It wouldn't go into the cell.
Yeah.
So, as I said, cabbage, broccoli, flax seeds, oatmeal,
All right.
quinoa, or however, millet, fluoride, hypertension
Okay.
medication. There's so many things that prevent the function of iodine getting into the cells.
Mm. All right. So if you supplement with iodine and you pair that with a good diet and you manage stress with
Yeah,
lifestyle,
yeah,
that's how you reverse or start to heal your thyroid, which affects all the functions of your
absolutely,
body. So you're saying you can't just do
absolutely.
one. You can't just supplement. Mm,
Yeah, perfect. You need the carnivore diet, you need the iodine, and you need to address stress. You need to make sure that, I mean, I'm an athlete. I go out paddleboarding in the sea. I went 3 days in a row. I'm not going to go tomorrow because I need to take a break. But if I did
mm,
it 7 days, if I will never race, I will not race, even
mhm.
though I'm good, because I know from my experience in martial arts, it's too stressful for me.
Yeah.
So I will be affecting my health. So I'm a carnivore
Yeah.
diet, take iodine, and I'm making sure that I don't overstress.
What's the optimal? Because you said, if you run marathons 3 times a week, then you're overstressing yourself. What's enough exercise? Like, can you talk about that? Because a lot of people, talk about, working out 5 days a week. And how can that be unproductive, right? If you're
Very
stressing yourself,
easily
you're,
unproductive.
yeah, yeah.
Yeah. Okay, so people didn't used to exercise. People just used to
Mhm.
work. This exercise thing is new. It basically
Right.
came out in the 50s when they told us to stop eating fat. I mean, you had boxers, you had people who were weightlifters, you had these isolated sports, but most people didn't exercise. They worked, they went to work, they walked, they lifted things, so this exercise thing is pretty new. It doesn't save anybody's life. And if you think about the guy who ran the first marathon, he died when he got there. When he arrived to tell the Greeks the Spartans were coming, or I can't even remember who was coming, he dropped dead. So there's an excess. It's an extreme. I love exercise, but it messed up my adrenal health because I did it too much. So what is good for everybody? There is no what is good for everybody. It has to be fun. It's good to move your
Mhm.
joints. It's good to have muscle so that when you fall down, you don't break. It's good to be agile, but it's not going
Yeah.
to save your life. It's not going to make you live
Mhm.
longer. It is going to make you live better quality
What is
life.
fun? Mhm.
Absolutely, for sure.
So what is fun? Like if it's not fun anymore, if it's too straining to your body, if you feel like you're always fatigued, it's time to
Yeah,
give
if you
yourself
don't
a break.
sleep,
Yeah. If you
yeah, if
don't
you don't
sleep.
sleep, your cortisol exercise is going to
Mhm.
make raise your cortisol more than if your heart rate is high for more than 15 minutes, your body thinks it's in danger.
Mhm.
So I usually tell people with issues to try to, if they're trying to heal something, to try to keep their cardio. I don't recommend cardio. I
Yeah.
would say weight training and walking would be the best to do.
Mhm. does time of the day affect it? If
Absolutely,
so,
morning.
what's
Cortisol
the
high in the
morning? Yeah.
morning, goes down. Yeah, morning.
So do it in the morning.
Morning between I wouldn't exercise later than noon because you have to if you look
Mm,
at the cortisol curve, it's high in the morning and then it descends, it reaches its apex in the morning and then it goes down to the lowest possible. You don't want it too low because then you won't sleep either. But for you to sleep and produce
mm,
melatonin, it has to be low. So if you go out for a jog at 7 or 8, or if you get up at 4 in the morning when your cortisol hasn't peaked yet, you're messing up your circadian rhythm, which causes stress, which will cause your liver to make sugar, which will
mm.
cause inflammation.
If I have all the signs of somebody with a thyroid issue, what are you going to check? Like, let's say I'm a patient of yours. What do you check? What do you ask me? What are the things that comes up in the first initial conversation?
I have a really long questionnaire because of all those
Hmm.
symptoms, right? I ask history and I look at labs. So I ask for temperature. Low temperature is an indication of low thyroid function because thyroid is a thermoregulator.
Is that the giveaway?
It's one of many: constipation,
Yeah.
hair falling out.
Yeah.
Just literally, it just goes. So I look
Mm,
at a lot of material in order to come to a diagnosis. Sometimes it's immediate. Sometimes people have great numbers, but there's something else hidden that tells me that they are hypothyroid
mhm.
from the years of experience I've had.
How drastic is the change? Let's say, for example, hey, I'm eating a standard American diet. I'm not supplementing thyroid. I'm eating all these anti nutrients, and then come to you. Did the program? If you do have a program, we'll link it. We'll link everything down in the description box below. If they're interested, connect with you. What's the drastic change? Like what happened? Like give me an example of a somebody that adapted this lifestyle, did everything that you said. What was the result? How
Pain goes
fast it is?
away.
Yeah,
2 weeks to a month.
2 weeks.
Well, I mean, if we're talking joint pain,
Yeah,
if you go on a high fat carnivore diet, you're eating Hostess Twinkies and French fries and I don't know what, oatmeal and
yeah.
avocados and stevia or those weird drinks, weird sugars that I don't even know because I
Mhm.
live in Italy. If you stop all those, 2 weeks is what I asked for, right? High fat carnivore diet. A lot of stuff gets better. And then we
Yeah.
figure out what you can add back in that doesn't cause inflammation.
If you adapt the carnivore diet and then add iodine supplement, what what h-
Mm.
what changes?
It depends. It depends how your
Right.
health is. Some people are so far
Yeah.
along the line, there's a lot of stuff to unpack. Some people
Mhm.
say, again, pain or my thoughts are clear. I don't have
Yeah.
brain fog anymore. I can go to the bathroom. I can
Mm.
sleep better. Or they get worse. Some people get
Yeah.
worse because there are more things to unpack. Because when you're
Mm.
healing, all of a sudden your body's like, oh man, she was so sick. I couldn't complain about this before, but now she's feeling better. I'm going to tell her this is messed up too.
Mm. That's interesting, right? I've been on a carnivore diet and I never thought of supplementing iodine, and I'm really
Mm-hmm.
thinking about it now. If you have any
You have a
recommendations.
you have prostate, so it's not just the thyroid that needs it. Prostate tissue in
Yeah,
males, mucus
right.
tissue,
Hmm.
adrenals need a ton of iodine. Every mucus, so your nostril, your respiratory tissue, your intestines, there's a tons of iodine in all those tissues. So, you know, 2 drops of 5%, you get it in the US very easily and no harm done. Unless you have an inflamed thyroid, you might overreact to it, or you're toxic with halides. If you're toxic with fluoride, if you've been using fluoride toothpaste and getting fluoride washes all the time, 1 drop of iodine you might have a reaction to it, like palpitations, because you got to get that stuff out before you can properly
Mm.
process the iodine.
All right, let's talk about that. I mean, that's pretty serious. What are those things that people need to address first or know first before they take iodine supplement? Because this is also
Well, it's
something that I want to do. Right, iodine supplementing. Right now, you've
right.
convinced me. But what are the things that I need to watch out for aside from those two that you already
I mean,
mentioned?
it's very, yeah, that's it, really. That's it. That's really it.
Okay.
It's very rare. It's usually palpitations. Somebody might have palpitations
Yeah.
because their thyroid is inflamed. So then you'd have to figure out if
Mm,
your thyroid is inflamed or got so much fluoride in you, the iodine's like, I'm trying to get in, and the fluoride's like, I'm here.
yeah.
And that's very easily fixed with a salt loading protocol, which Dr. Brownstein in his book Iodine isn't, I don't remember the title of it, but you
Mm,
take salt and water till you and iodine and you flush out the toxins that are taking the spot where the iodine should go.
mm. Awesome. Awesome. And do you have any program if anyone's interested, Dr. Elizabeth?
I see patients online. That's my program,
Okay.
and that's it.
All right. Awesome. Awesome. Well, I learned a lot from you today. Again, I've been on a carnivore diet for a few months, been on a keto diet for years. I haven't really thought about, supplementing iodine. And it's really interesting to me with exercise too, where you really have to, we think about, hey, we gotta build muscle, we gotta work out 5 times a week to build muscle, and not really thinking about it may be counterproductive to over exercise, and we would never really think of
Hmm.
that, right? And we talk about a thyroid issue being that you called it something. Is it master hormone you talked about?
That's a
Can we call
master
it
hormone.
that?
It's the conductor,
Yeah.
entire orchestra in the body. It rules everything. It regulates everything.
Yeah, it's definitely worth it to get that checked if you have all of those symptoms. Obviously, hopefully the listeners wrote all of those symptoms to make sure that you are not taking any type of medication if you don't have to, right? And I think that's the most important piece is just to be able to really educate yourself about what you can do holistically. There are a lot of alternative ways to really heal the body from within, right? So, thank you so much, Dr.
That's
Elizabeth, for coming on and sharing your story with us today. This is a wonderful conversation. I really love having you here. Learned a lot from you. Where can people find you and connect with you, Dr. Elizabeth?
elizbright.com. That's my website.
LizBright.com. We'll link it down in the description box below. You guys can check that out. Connect with Dr. Elizabeth Bright. Dr. Elizabeth Bright, thank you so much.
Okay. Have a nice evening.